The renal pathology section builds on what we learned in renal physiology and anatomy. If you have a good understanding of renal physiology and anatomy, many of the renal pathologies and their symptoms will be intuitive. Let's start off by talking about casts in the urine. Casts are something that you can see when you look at urine under a microscope. Casts are important because they indicate a tubular pathology, since the cast itself is shaped like the tubule it came from. When cells get clogged up in the tubule and then get pushed out by the urine, they'll come out in the urine as casts of cells shaped like the tubule. And the protein that makes up the cast and kind of holds all those cells together is called tam horsfall protein. Now, more importantly, different casts can contain different cell types or macromolecules, which indicate different pathologies. For example, a cast of red blood cells means that RBCs are leaking through a damaged glomerulus, like in glomerulonephritis, ischemia, or malignant hypertension. Whereas a white blood cell cast means that there is some sort of infection or inflammation in the kidney itself, like tubulointerstitial inflammation, acute pyelonephritis, or transplant rejection. Fatty casts, on the other hand, are a sign of nephrotic syndrome. And granular casts, made up of the tubular cells themselves, are due to acute tubular necrosis. Waxy casts are going to be seen in chronic renal failure. And finally, hyaline casts are nonspecific and can be seen in concentrated urine in a person who may be dehydrated. On the exam, the patient may present with genitourinary symptoms, and the morphology of the casts will lead you to the right answer. For example, what if the patient has white blood cells in the urine, but not in the form of casts? What do they have? This means they have acute cystitis, which is an infection of the bladder, because the WBCs would be in a cast if the infection were in the kidney, but they're not in a cast, and that's the sign that the WBCs are coming from the bladder. Now let's briefly go over the nomenclature for understanding glomerular disorders. This will make the array of pathologies much easier to understand. So if less than 50% of the glomeruli are involved on a cross-section of the kidney, then it's called focal. And if greater than 50% are involved, then this is called diffuse. Now, proliferative disorders refer to disorders where there is an abnormal increase in the number of cells in the glomeruli, such as diffuse proliferative glomerulonephritis, where it looks like there's just a whole lot of cells in the glomerulus, more than normal. Membranous disorders involve thickening of the glomerular basement membrane, also referred to as the GBM. Primary glomerular disease only involves the glomeruli, whereas secondary glomerular diseases are diseases of another organ system that then affects the glomeruli. For example, diabetes, which is a pathology of the pancreas, but it has effects on the glomeruli of the kidney. Let's look at the different types of glomerular diseases. Now, this fact is really important. This lays down an organizational framework for all glomerular diseases. Although nephritic syndrome and nephrotic syndrome are usually separate entities, there are a couple of diseases that can present either way. And these include diffuse proliferative glomerulonephritis and membranoproliferative glomerulonephritis. And this is important because they have to be considered as both nephritic and nephrotic. And this diagram is a good way to help you keep track of which diseases are nephritic and which ones are nephrotic. So refer back to this diagram when you're doing your final quick review before your exam, and it'll help you refresh yourself on which ones are nephritic and which ones are nephrotic. Now let's check what we know with a flash quiz. Name 3 diseases in which white blood cell casts are seen on urinalysis. The answer is tubulointerstitial disease, acute pyelonephritis, and transplant rejection. Now, in all of these diseases, white blood cells have been able to reach the lumen of the renal tubules. And they've bunched up inside the tubules, and when they get pushed out by the urine, they'll come out as a white blood cell cast in the urine. And it may have been through glomerular damage or it may have been through tubular damage, but somehow the white blood cells were able to get into the lumen of the tubules and form a white blood cell cast.